Welcome to Your Family's Health. This is Professor Joan Buckley from the Department of Nursing here at Nassau Community College. Your Family's Health is a program that focuses on healthcare issues and resources available to you here in Nassau County. On the show, we speak to experts from around the country and today around the world. We're going to France to keep you up to date on current healthcare issues and trends. So we're going to be speaking to Dr. Friedman Schwab. He's going to talk about his award-winning book, The Fear and Anxiety Solution. He is a cardiologist and a molecular biologist. He's helped thousands of people with personal breakthrough and empowerment program that he has to overcome emotional challenges. So if you want to know more about how to stay healthy here in Nassau County, stay tuned for the next half hour to the Voice of Nassau Community College, 90.3 WHPC. So welcome to the show, Dr. Schwab. And we're very excited that you've actually been able to connect with us so beautifully. And one of the things that I am sure with your introduction talks about your beginning as a cardiologist and then a change, more or less, in your focus or the vision for yourself. How did that happen? Can you talk a little bit about who you are? Who is Friedman Schwab, the doctor?
Well, how much time do you have? No. Well, basically, this change happened, you could say I was focusing first on the physiological heart or the anatomical heart, and then I just shifted more to the emotional one for many reasons. One of them was that I was suffering from anxiety myself since I was little, since I was about 11 years old. And the second one is that I saw so many of my patients suffering from anxiety, not even, after they had a heart attack or any, problems with their body. It was actually before that they were very stressed out or they were dealing with a lot of, unresolved issues like insecurity or put too much pressure on themselves and, call this anxiety. And but we couldn't do anything, as cardiologists who were just, standing there, staring at them and, saying, okay, yes, interesting, and how much butter are you eating? Are you smoking? So we really focused more on the body, and we completely were unable to help on the emotional side. And more studies show that the emotions have a huge effect on our body, and at some point it was just clear to me that in order to prevent physical problems, like problems with the heart or high blood pressure or strokes, in order to prevent those things, we need to learn how to resolve our stress and our anxiety, and that's when I started to focus on that, and focus on that in a way that, for me, feels just more holistic, because it's not demonizing or disordering stress and anxiety. It just says, we are creating it, so we need to find out how to uncreate it, and we need to understand what are these emotions actually telling us in the first place. And that's, in a nutshell, my approach.
Well, it's very funny, not funny really, but it's interesting. That's a good word. When we talk about the mind-body connection, we talk about who the person is, and it is such a critical part in even education of primary care physicians, knowing who the person is, where they came from, and things like that. But when we teach the terms in nursing, now, anxiety and fear, those are two terms that I've seen over and over in your website and things. Anxiety is like the unknown, right? It's kind of like what we don't know, but it's a feeling.
Right.
And fear, we actually have something to be afraid of. But how can we, or how have you looked at trying to establish that that basis for identification of anxiety in a practice? Like when you get the patient, like you said, as a cardiologist, it's almost like, okay, too late. Not really, but it's like after the horse, right? So after the damage is done, then you look back and say, oh, the person has had anxiety over the past couple of years. How do you see us making a change in even how we approach primary care and trying to eliminate the causes? Do you see it as like just better education about the holism of the body, like really focusing more on the mind almost than the physical aspect at an earlier stage?
Yeah. Well, I mean, I don't work in cardiology at all anymore, so I'm really only focusing on that aspect of the emotion and the mind-body connection. But I think, when I was, for example, looking back at my days in cardiology was what's like in the mid-'90s, my head of the department, he didn't believe at all that emotions had an impact on the physical body. Now, he was also a type A personality, so he was highly stressed, and maybe he was just in denial. But, I think these days we just have a greater awareness, and I think more and more people also know about the benefits of breathing or meditating or journaling, and they follow through with it. Just like, organic vegetables and fruit are now much more in the forefront of people's minds than before. I think so. There are also things we can do for our mental and emotional well-being that are much more common, and I think are much more used, and also much more needed, because when we look at how, fear and anxiety gets created, it has a lot to do with our external environment, and there it has a lot to do with how our mind gets often bombarded with so much information and such an overload. And just as we are all hooked to our phones and tablets, we just get so much of sometimes junk into our mind that our mind cannot really deal with all of it, which is one of the main reasons why people are more stressed and feeling overwhelmed, because what technology has been able to accomplish and how fast it evolved, we on a really like anatomical, neurological, emotional, psychological level, we couldn't really keep up. We are limping behind. We are still basically people that need 8-hour rest, that need less information, that need less stimulation. But we are not necessarily, giving this to our mind and our body. We are just trying to be as efficient and as always on like our computers, and that's not possible.
Who's the audience, though? Who is saying, are you seeing general practitioners or nursing or any of those areas that are professions that work in healthcare? Are any of them saying, this is great, can you come speak to us? Or can we get more information about this? Because if you can infuse it in the education of healthcare professionals, possibly, right? We may, as primary care, maybe kind of prevent some of these fires from occurring. And I know you're not practicing in cardiology, but are you being approached by other areas of healthcare about like, how can I infuse this in my practice?
No, unfortunately not. And
oh dear! And I thought it would fit right in with our program.
Well, it would be nice.
It would,
thank you very much.
Yeah.
No, but I mean, it's just something that I don't know if it's not necessarily yet so clear that fear and anxiety cannot just be treated with medication, that there needs to be other approaches. I don't know if I just know from my medicine days that allopathic medicine is a little bit like slow when it comes to really getting used to new things. And at least this is how it was, in the hospitals that I was working, just making some adjustment and some radical changes in, for example, seeing emotions not just something that needs to be right away suppressed, but maybe something that needs to be addressed. That didn't really happen when I worked in these hospitals. So I'm reaching out. I'm having my radio shows. I'm like on radio shows like yours.
Yeah, you have a huge.
I think at some point it just also it depends on when more and more patients are coming to their doctors and saying, what, I actually have a different opinion and a different approach. Then I think the doctors will also maybe listen more.
Yeah, I wonder if it's their subconscious, way in their subconscious. They know that this is the basis of everything, is how people feel and the things that they react to. But we know that in their conscious mind, they're a profession and they have certain protocol to follow. What is the difference between subconscious and how is that different from the conscious mind? Because people don't always realize that they're anxious and but they know something else. Like they know they don't like tests, but they don't know they're anxious about test taking. That kind of thing. What's the difference between a subconscious and a conscious mind?
Well, I mean, the conscious mind is basically that rational, logical part of the mind. That's kind of our head. When we're saying we are in our heads, we don't really feel much. We are more focused on problem-solving, practical aspects, things like that. And often we believe that we run our life with our conscious mind. Now, studies show that the conscious mind is pretty much, inferior when it comes to daily living to the subconscious mind, because we do so many things unconsciously or subconsciously, even driving or, pouring coffee at breakfast or, washing your hair in the shower, because your conscious mind may take you somewhere else. You may be already in the office, or you may be in the middle of a conversation, and your subconscious mind does pretty much all this automatic behavior without the conscious mind having to interfere. And so the subconscious mind will probably do 70 to 80% of your daily activities, and your conscious mind only about 20. Now, the subconscious is also basically in charge of the mind-body connection. It's in charge of the emotions, of the memories, of our deep-seated core beliefs. So it's a pretty busy part of the mind. Now, the subconscious has one flaw, despite its huge potential. The flaw is that it needs kind of input in order to change its mind. So this is important for anxiety to understand, because we develop these anxiety patterns like, avoidance of tests, for example, or, pleasing other people so that they don't reject us, or achieving certain goals to always feel somehow worthy. These are all anxiety patterns that we are developing early in our lives, and we will continue to run those patterns, or those patterns run our life, until we are consciously changing the way the subconscious is acting and seeing us and seeing the world. And this is, what my work is focusing on. How can we consciously be more, in charge of our subconscious mind? How can we help our subconscious mind to resolve those anxiety patterns and replace them with behavior and beliefs and patterns that are much more supportive and confidence building?
This is the perfect time for a break. You're listening to Your Family's Health on the Voice of Nassau Community College at 90.3 WHPC. This is Joan Buckley, and we're going to continue talking with Dr. Friedman Schwab after this short break.
Peekaboo, peekaboo, smile.
Smile, buddy.
Come on, smile. Oh, honey, he's still not smiling.
Maybe he's not a smiler.
Yeah, maybe he's just not a happy baby.
Maybe he's just being a boy. You know how boys are.
Or maybe he's teething. Oh, poor baby. I think his gums hurt.
Maybe he's just tired.
Or maybe his tummy hurts. He didn't eat that much.
Maybe he's not ticklish.
You think maybe he's scared of the dog?
Maybe he'll outgrow it. Maybe it's a phase. Maybe he just doesn't like smiling.
Maybe he has autism, and we can definitely do something to help.
Maybe is all you need to find out more about autism. No big, joyful smiles by 6 months is one early sign. Learn the others at autismspeaks.org/signs or see a doctor today for an autism screening. The sooner it's diagnosed, the better. And it can make a lifetime of difference. Brought to you by Autism Speaks and the Ad Council.
Welcome back to Your Family's Health. This is Joan Buckley, and we welcome back our guest, Dr. Friedman Schwab. Now, Dr. Schwab, before the break, you started saying, or actually you asked a question. How can we move in a direction that we're in charge? When anxiety kind of influences our subconscious, how can we then take charge? I think that was where we kind of left off before the break.
Right. Well, I think it all starts with just getting this awareness that the anxiety, especially if it's a chronic anxiety, is similar to physical pain. When people have pain, They don't necessarily say, well, there's something wrong with the